Good afternoon, everybody, or should I say good morning or good evening, depending on where you are. My name is Jeff Hardy, and I am the founder and CEO of Lifeguard Digital Health. I'd first like to start by just acknowledging and thanking Pennington's Institute for having us to be part of such an important day, an important cause to bring awareness to this pandemic that is not going anywhere and is not going anywhere anytime soon. So this is our second time working with Pennington's to acknowledge this and to be part of it. And I want to make a special thank you to them for continuing to offer this platform for those of us to get our voices out to support. Lifeguard's journey is a personal one and very much fits into this day and its support and what we do in our mission. I myself, I am a recovering alcoholic. In 2016, I found myself in treatment. I wish it was the first time, but it was more like my fifth and sixth. And at that time, it was, as they say, the last stop or hitting rock bottom for me. I'd lost my family, my business, any self-worth I had, and really was, for me, was the time where I was either going to be incarcerated in jail or was going to die. And I decided to take the latter and get some help and start a new journey of being healthy and in recovery. So while I was at treatment, I was also introduced to somebody, a very special individual his name was Evan Barazan. And Evan and I, to be honest with you, we didn't hit it off at the beginning. He was kind of a goofball, but he was 27 and I was 47. So more like a little brother, if you will. And through sharing and parts of the treatment, there's a lot of counseling and I learned a lot about him and hopefully vice versa. But we bonded over one thing in particular, and that was where we were, both of us, in our relationships with our daughters. Evan was, unfortunately, had to give his daughter up for adoption because him and his partner were just not in a position where they could take care of her. And with my daughter, who had suffered and had gone through at least 15 years of my addiction, by the time we got to 2016, she had had enough, and our relationship was really one that was on the rocks, and one that I really wanted to mend, and knew that the only way around that and to do that was to get healthy and sober. But as Evan and I, our relationship grew, we were getting closer and closer, and he had just celebrated the opportunity to get a job opening and to apply, and got a job, and we were really happy for him. A couple of weeks after he started in his job, it was a Friday afternoon, and he was off the job site heading home, and I'm not sure why, but for some reason, and a story that we hear a lot of, Evan started and tried picking up one more time, got back to our facility on a Friday afternoon. He used, and we found him Monday morning. He had suffered a fentanyl overdose. So of course, as you can imagine, this was devastating. The friendship that we had made and the bonding we had done, and to end in that regard was difficult. Through that, though, I started to get an idea. How could we prevent people that are alone from suffering from an overdose or any type of crisis? How could we bring help to people that were alone? And the one thing that came to mind over and over was using a cell phone. And I always like to interject here and talk a little bit about the fact that I really don't have a lot of technical ability. So for me to be CEO of a tech company obviously supports the fact that we have a fantastic team. But I could see a product. I could see it in my head, and the tools that I had at my disposal while I was in treatment, I had some pencil crayons and I had some napkins. And I took those things and I started to draw out screens as I could see them. And that really introduced us to what was the first product. And, at the time, I thought the title or the name of the company, Don't Die, was very fitting. It was to do two different things. Number one, to support and to use our now patented timer technology, and also to do two other things, which was to connect somebody immediately to a suicide or crisis line. And the idea was always to capture somebody in that moment if and when they wanted to get to treatment. They could hit a button on the application and that would connect them immediately. And that perfect timing wasn't wasted, if you will. So what we did at that point is we were able to develop a prototype. We got the prototype to local government. It really wasn't that looked upon as a great idea, but it wasn't really at the point where anybody was going to invest, and the technology wasn't ready to support it in a big environment or a bigger geographical area. But we did get the opportunity to take the product and to put it into trial. So we were able to take 4 supportive housing locations and we went into trial for 2 years. The best part of that was on day one, we were handing out the phones, and somebody used the application, and we were looking around because the alarm was going off. Paramedics showed up, and we had saved our first life. So proof of concept was there. Yes, I was surprised, but pleasantly. And that trial took us over 2.5 years, right into COVID. But during the 2.5 years while we were in trial, we also started to get a lot of great feedback. And that started the road in terms of where was Don't Die going to start to develop, and where was it going to go to into a new product. We found out quite quickly that a lot of the other things that people were looking for were connections into mental health and substance support services. So we decided that we were going to develop a new application that had tiles on the front and would give you very easy access to CPR guides, to naloxone guides, direct to nurses or doctors' lines, things that at your fingertip and privately and anonymously would get you connected into different supports that you need. And that was all in conjunction and together with our technology, which was the opioid timer that now has been very much so the leader in getting our 273 lives saved. On this screen here, what you'll notice is, and what we're very proud of, is taking the information that we received from our applications and understanding that different communities, different geographic locations, different demographics were very much in need of different supports to support them. So our first customized application was one from our Indigenous population locally, the Métis Nation, and we took things like imagery and colors, cultural understanding, using their community numbers first for support, which of course were ones that they'd already invested in, and made them feel more like this was their own application, one that they could rely on. We also expanded that into trades, and our newest launch was to Compass, which is our post-incarceration. And our next one will be to the university students, where we're developing one that will use special supports for them. We'll use campus supports and develop a more accurate application for them to use in their own environment. I'd like to take this opportunity to just close up by mentioning a few of our new partners. As I had mentioned, we have now launched in Melbourne. I'd like to take a special opportunity to thank Mayor Reese, who has supported us the whole way through. I'd like to thank the City of Melbourne. I'd also like to thank Invest Victoria, who since day one that we have been discussing, talking in Australia, have been behind us, have been looking for and opening up doors for us and ways to get our products and our voice out there to the people in Australia. I would also like to make another special thank you to the University of Torrens. We currently have just wrapped up our first 2 capstone projects. And yesterday, I was so thrilled to be part of the final presentation of the students there, who, I have to be honest, to my surprise, over their time in the project, really did get a great understanding of our products. Their main focus of the project was how can we get Australia and Lifeguard to adapt each other so that it would fit into the Australian landscape. And I'll tell you from the presentations, these students, they knew exactly what they were doing, and bravo to what they found and what we're actually going to start to implement. Last but not least, I'd like to thank the Australian Paramedics Association of Australia. They are our ongoing partners. As we've talked about, all of our products do connect into EMS, and without those partners and partnerships, we'd have a very difficult time to saving the lives that we have. I'd like to give a special thank you from our company, Lifeguard Digital Health, from me personally. This product and these opportunities to speak are near and dear to my heart. My friend Evan and his family would love to tell you how appreciative they are that we get to be here. And everybody stay safe, and let's keep putting the word out there and keep those voices loud, and we'll get there. One day we're going to look behind us, hopefully, and this will all be behind us. But for now, let's stay strong and let's keep moving on. Thank you so much.